Hello. Good morning. Good morning, everybody. We are very lucky. We are very lucky to celebrate our 100th tribute to Ilizarov on his 100th birth anniversary. Bangladesh Assami, the Bangladesh chapter, is going to celebrate with the international faculties. I welcome everybody. Our chairperson of this anniversary is Honored Professor Mofakharul Bari, and the keynote speaker is our President Bangladesh Orthopaedic Society, Director Nitor, and Secretary General of Assami Bangladesh Chapter, Professor Abdul Ghani Molla, is on the dais, and the peoples who take fellowship from Kurgan is here, especially the foreign faculties, Jin Chang Jung, Professor Novikov, Professor Harshad, or one of the close friends, Professor Gamal, our teacher of the teacher, Professor Shamsuddin Ahmed, our teacher, Professor Khondakar Abdullah Rizvi, our mentor, Professor Ramdev Ram Koiri, and our proud Professor M. Amjad Hossain sir is here. I, Professor Wahidur Rahman, the Secretary General of Bangladesh Orthopaedic Society, is welcoming everybody in this anniversary and this occasion. I will request our two junior colleagues, Dr. Nazmul Huda Setu and Dr. Tanvir Ashraf, to conduct the session with these few words. Hopefully, I hope this session will be very much glorious, educative, as well as fantastic. After a long time, it is our sorrow during this pandemic situation. We are not traveling abroad. If it would be possible, then at least Professor Bari would be in Kurgan. With these few words, I requesting Nazmul Huda Setu and Dr. Tanvir Ashraf, please continue the program with the chairperson, Professor Mofakharul Bari, and keynote personnel, Professor Ghani Molla sir. Thank you very much. Thank you, everybody.
Assalamu alaikum and very good morning to everybody. This is a great pleasure and great honor for us because of we're going to celebrate the 100 years celebration of the legendary orthopedic surgeon, Gavriil Abramovich Ilizarov. He's the man behind millions of smiles, behind millions of recovery. He's the magician of the magician. From Nitor, we show our respect. From Assami, Bangladesh, we give salute to the legendary orthopedic surgeon. Dear viewers, I would like to thank our Secretary General of Bangladesh Orthopaedic Society, Professor Dr. Wahidur Rahman sir, for giving me a scope to conduct this session. Now I would like to request a very prestigious person, that is Professor Abdul Ghani Molla sir, the President of Bangladesh Orthopaedic Society, the Secretary of Assami, and the present successful Director of Nitor. I would like to request Professor Abdul Ghani Molla sir for his welcome address. Professor Abdul Ghani Molla sir.
Bismillahirrahmanirrahim. Today's the 100-year birth anniversary of Gavriil Ilizarov. We are celebrating Assami International Bangladesh chapter, celebrating this program in Nitor. with the collaboration of Bangladesh Orthopaedic Society and the National Institute of Dermatology and Orthopedic Rehabilitation. We are in this prestigious occasion. We are very much grateful and very much happy to see the international faculty of Elizabeth in the world, like Professor Prof. He is our president of the Assam International Bangladesh chapter, and our grand teacher, the teacher of the teacher, great orthopedic surgeon in Bangladesh, Professor Samsuddin Sir is here, ex-president of Bangladesh Orthopaedic Society, Professor Amjad Hossain, Professor Khandokar Abdullah Rizvi Sir is here, Professor Ramdauram Khairi is here, and the international faculty, our great teacher, Professor Nobikov from Kurgan, Professor Cheng from Beijing, Professor Harshat from Bangalore, India, Dr. Samsuluda from Bihar, India, and other international faculties are here. The Ilizarov, the great man Ilizarov, the teacher, the great academician, he invented a method of orthopedic practice. It is the great, we bless our gratitude and our wholehearted respect and honor to that great person. We are lucky that we are able to celebrate his birthday anniversary, 100-year birthday anniversary. The man is no more in the world, but his activities, his discovery, his invention, Ilizarov, is all over the world. And the patient, those who are benefited by this method, the fantastic method, where there is no solution, the solution is Ilizarov. So the Ilizarov, in the name of the great magician and great academician, G.A. Ilizarov, is favorable all over the world. So in this occasion, I don't want to extend my speech. I welcome everybody to this great occasion, and I give my gratitude and respect to the senior teachers, those who are coming from the home and abroad. So with these few words, I conclude my speech here. Thank you very much for your patient hearing. Thank you very much.
Thank you, Professor Abdul Ghani Mullah, sir, for your excellent welcome address. Now, I would like to request the legendary Ilizarov surgeon and the pioneer Ilizarov surgeon in Bangladesh, who spread the love of Ilizarov in Bangladesh, that is Professor Mofakharul Bari, sir, the president of Assami Bangladesh chapter. I would like to request Professor Mofakharul Bari, sir, to say something regarding the biography of the Ilizarov. Professor Mofakharul Bari, sir, President Assami.
এটা তো তোলা যাবে না Bismillahir Rahmanir Rahim. My dear all foreign faculties and our senior Bangladeshi faculties, and today I'm very much lucky that we are going to observe this 100 years birthday celebration of Professor Gavriil Abramovich Ilizarov. And today I would like to share my experience with the history and some of the cases that we are doing in our country with this Ilizarov technique. Move Okay, these are the places. Okay, these are the places that I have taken my training, and these are the, I must say, my two institutions where I did my PhD and MS, Tashkent and in Kiev. And this is the orthopedic capital, and this is our institute that I worked more than 10 years here. This is a 1,000-bedded hospital, and here are the faculties you can see. And this is now I am, for the current time, I'm working these two hospitals in Barden, biggest hospital in Southeast Asia, and Bangladesh Institute of Health Science. This is my center, this is Kurgan, this is Professor Ilizarov, 4M, you can see man, meat, method, and magician. And location of the Kurgan, you can see 3,000 kilometers from the Moscow. So Ilizarov method has established itself as a powerful technology for the management of a great variety of bone diseases and conditions. It is considered by us as a system that is based on biological laws and the technological philosophy. We must know this tension stress effect that stimulates the biosynthetic activities in tissues. We must know the adequacy of blood supply, gradual lengthening and correction. This is the fundamental principle of Ilizarov methodology. And possibility of full-time control, we can see the callus formation. Of course, the early limb functioning and loading is very important in this Ilizarov technique. So magician of the Kurgan, you can see is Gavriil Abramovich, born in 1921, 6 June, 15 June in 1921, and passed away in 1992, 27 July. He graduated in 1944, and he invented his transosseous osteosynthesis in 1952. In 1968, he did his PhD regarding his thesis, and on the same meeting, they conferred him the DSc, Doctor of Science, and which has conferred him in 1969. In 1970, there was a symposium, and you can see here the picture of the Fidel Castro. In 1976, all Soviet conference was held where he demonstrated theoretical and practical aspects of transosseous osteosynthesis. You can see the Professor Ilizarov is talking with the patient. You can see, just look at this picture, with no leg below, how to go for lengthening of the amputated limb. Professor himself, academician himself, is just describing. He's talking in Russian, that's why I've omitted that one in Russian language. You can see how his smiling face. This is occurring in 1990, and he died in 1992. 84, there was a conference in Italy, and Asami was formed in 1985. Look at this, he lived for 17 years, worked for 40 years for his method, and he worked in Kurgan in 21 years. So this is with Professor Shivsov and Dror Pele. So 1992, he published a book that was the 8,000 cases in English and 656 pictures with 3,100 illustrations. And these are the foreign awards he got. And when he was well known because of treating the Carlo Mauri, the Italian patient. And this is the family of Professor Gavriil Abramovich Ilizarov, Svitlana, his daughter, and the right side, I was just smiling with that fellow, the son of Professor Ilizarov, Alexander.
During 20
this
years, the famous Italian traveler,
you can see here,
Carlo Mauri, a member of the world team of the Thor Heyerdahl expedition, had constant pains in the affected leg after an accident in March.
So this is so extraordinary theory and principles he developed for the treatment of bones are of even greater significance than his instrumentation and devices. You can see his first model of Ilizarov external fixator. So what are the contributions of Ilizarov? Very important 4 things are: first, biologic law, and second one is the method of corticotomy, how to do the corticotomy. By doing corticotomy, you can lengthen whatever you like. And destruction, compression, osteogenesis, neurogenesis, myogenesis, histogenesis, tissuegenesis, and of course the myriads of instruments, the thousands of instruments. So the procedure and the first apparatus designed by Ilizarov, you can see a shaft bow harness on a horse carriage. Originally bicycle parts were used for the same frame. Now you see how he taught bamboo. He took a wooden stick and he tried himself how to pass the wires. And this is in 1950. You can see at that time, 1950, how many years back? You can see this is doing his passing. This is the Ilizarov himself. He's doing this kind of, bone model, not bone model, wooden model. Okay, this is his first apparatus. And this is the car which is situated in front of the museum of the Ilizarov Center. So now this is the 850 beds hospital, 18 departments, 24 operation theaters, more than 350 orthopedic surgeons, and 1,500 nurses, therapists, and ancillary personals. So this is the center, so beautifully decorated. And I must say, in 2011, 44 orthopedic surgeons from our country visited this hospital, including the most senior orthopedic surgeon, Professor Shamsuddin Sir. And this is in, winter snowfall. You can see in summer. Now this situation in summer, and this is the front gate of the Ilizarov Center. This is the museum. This is the Ilizarov Museum.
The doctors and scientists of the Russian Ilizarov Scientific Center for Restorative Traumatology and Orthopaedics have given back the joy of life to thousands of patients, brought fame to national medicine and honor to our state.
This is Professor Catagni, who introduced Ilizarov in Italy first after the Soviet Union. And then I myself will draw Pele with Professor Chin from China and other faculties from the Western world in the left side. We conducted several times Ilizarov conference in our country. Professor V.I. Shevtsov, he's the disciple and successor of Ilizarov, came 8 times to Dhaka. And you can see here Professor Shevtsov and Professor Gavriil Abramovich Ilizarov, when they were flying, they were going from Moscow to Kurgan. And both this genius orthopedic surgeon, you can see here. So these are the different situations. This is the now new director. This is the animal center in Kurgan, and this is the magician of Kurgan. You can see, you can correct the
for managing severe spinal deformities, such as scoliosis of 2nd to 4th grade, kyphosis, spondylolisthesis, acute and neglected vertebral trauma, including the one complicated with spinal cord injury.
So you can see the animal in the cats. You can see how they put the dog. This is the animal center. So method Ilizarov is not hard to learn, but it takes proper knowledge, effort, devotion, patience, practice, intelligent, meticulous follow-up, and basic understanding of kinesiology, kinematics, anatomy, physiology are mandatory before attempting to master this technique. Today, we have gained a very strong foothold in Bangladesh, and we can demand for that. This is in 2013. They have made me a distinguished professor of that center, June 2013. So this is my student life when I was working in Kurgan Ilizarov Center. These are the situations. I would like to proceed faster. So this is, all American giants left side with Kinsey, stalwarts of Ilizarov technique. This was in Brisbane, all stalwarts from all over the country. And today we're going to observe the 15th June, the World Ilizarov Day. and in my country we're doing. Now I'd like to touch something regarding the deformity correction of the Ilizarov. Pre-Ilizarov era, you can see there was no normal situation at that time, no satisfactory treatment. All the time they are doing nothing, prosthetic fitting or amputation. But in 1950, Ilizarov popularized the principles of gradual destruction osteogenesis, law of tension stress. There was no deformity that could not be addressed with Ilizarov's circular frame and biological principle of destruction osteogenesis. Dear friends, I would like to draw your attention regarding this. If you think about the orthopedics and traumatology, Ilizarov fixator and his biological principles of gradual destruction revolutionized the management of limb deformities. Look at this, limb length discrepancy, any bone and joint deformities, soft tissue contractures, bone loss, delayed and non-unions, infections, transverse dissection, and of course, you can solve the problems with the ischemic limbs. So now let us see the Ilizarov legacy. Three things: Ilizarov's fixator, circular fixator, principles of destruction osteogenesis, you can see here, and newly formed degenerated bone. Unique in vivo tissue engineering technique. No other available technique could form new bone. Unlimited quantities you can get, and same micro and macro structure as native bone. Of course, you'll get vascularized bone or tissue with simultaneous regeneration of all soft tissues. So you can see here, no other options except Ilizarov, this kind of deformities, LLD and deformities. See upper limb deformities, you can solve only with Ilizarov. See the bone deformities, bone quality of the rickets, you can solve with only Ilizarov technique. Other technique you can apply, but outcome will not be so excellent just like Ilizarov. Same dwarf lengthening you can see here, and gradual correction of severe angular deformities you can see here through soft tissue or through osteotomies. Post-traumatic tibial gap non-unions, look at the left side, big gap. So you can correct all these things, and comminuted fracture. You can see these are the cases that you can solve with this fantastic magical Ilizarov technique. And what is Ilizarov true legacy is not only the contributions is made about 70 years ago. Most importantly, colossal stimulus, I must say, huge stimulus, which was described Alexander Gubin, director of the Kurgan Center. That is his real legacy to reach new heights. Nothing is impossible. Today we can do anything, whatever we like. And what has Ilizarov taught me? There is a solution for all kinds of bone and joint problems. The principles of all devices are the same. New are not necessarily better. A tensioned Ilizarov wire or K-wire is an amazing device to respect the vascular anatomy.
Recording in
Minimally
progress.
invasive surgery. Patient can talk next day after the surgery. Load and motion is equal to your getting healing. So traveler, there is no path. The path is made by walking. Look at this. Ilizarov magic has no limits. Look at this. Director of the medical science daughter. He traveled outside my country, and inside my country, everybody suggested him to go for amputation. And what we have done, look at this. Look at this X-ray, before surgery, after surgery. And learning points, I'm going to finish now, dear friends. Ilizarov was a giant in orthopedics. His principles of destruction osteogenesis has revolutionized the management of limb deformities. His true legacy, however, is the continuous stimulation and inspiration that his contribution have on the medical and scientific community to study, discover, innovate new areas in the management of limb deformities, to continue basic science and clinical research in the field of bone deformities and regeneration. And I must say, you are all orthopedic surgeons. If you have time, once in a life, try to visit the orthopedic capital. What kind of research work they are doing. And Ilizarov is the property of whole world. not only for the orthopedic surgeons. Now the Ilizarov surgery is using in urology, in geriatric surgery, in gynecology. And the man who invented this apparatus and technique, great scientist, talented doctor, gifted innovator, creator of the apparatus, the transosseous osteosynthesis. Ilizarov shoulder, and you will continue our effort. The physician must observe nature, learn from it, and to be able to rectify its flaws. So, and I am very much happy, and in Bangladesh, we are doing a lot of cases, and we can show our talent. And we have got a lot of opportunities because we have 170 million people. And its utility is unlimited. And development of Ilizarov surgery, we have done all these things, and we are trying. See, children, in Kurgan and in my country. And dear friend, finally, I always love to show this slide, carry home message. What I have shown you, this is the evidence. What I talked on there, that is the science. And of course, if you want to do something, this is the surgical skill of the surgeon. And in my country, we are doing a lot of cases, I told you. This is only based on biological and mechanical. And we are happy that Bangladesh has gained a very strong foothold on Ilizarov surgery. Excellence is not luck, dear friend. It is the result of a lot of hard work and practice. Hard work and practice make a person better at whatever he is doing. There is magic wand for success. Success comes to doers, not observers. So thank you so much for your patient hearing.
Recording stopped.
Thank you, Professor Mofakarul Bari, sir, for your nice and magnificent presentation. Now, I would like to request one of our national faculty, who is the teacher of all teachers, the legendary orthopedic surgeon in our country, Professor Shamsuddin Ahmed, sir. I'd like to request the Honorable Professor Shamsuddin Ahmed, sir, to say something regarding the 100-year celebration of Ilizarov. Would you please connect Professor Shamsuddin Ahmed, sir?
Assalamu alaikum. Dear friends, I am really pleased and thankful to be able to join this 100 years of birthday celebrations of Professor G.A. Ilizarov, organized by the Assami, Bangladesh. Professor Ilizarov was born in Russia on 15/6/21 and passed away on 24/7/92. I pay tribute to this great scientist, academician, and orthopedic surgeon of 20th century. His powerful technique has revolutionized the management of a great variety of bone diseases and the conditions based on biological laws and technique and philosophies. Some of the examples are limb length deformities, acquired or congenital, leg length deformities and discrepancies, bony and joint deformities, bone loss, delayed union, non-union, ischemic limb, post-operative and post-traumatic osteomyelitis with implants, and stump lengthening, congenital pseudoarthrosis of the tibia, and so on and so on. These above mentioned, particularly these above mentioned conditions, were really a problem and a difficult problem for us to treat really with desired success by the other conventional methods in orthopedic surgery. We were really unhappy with the treatment of this surgery, and it's a great salvation also for us by this method of Ilizarov treating particularly the above conditions. It has really rescued us, particularly these conventional methods before the advent of this Ilizarov technique. Professor Ilizarov's invention has now indeed restored the joy of life to thousands of the patients around the world. Now I want to say something about the Ilizarov, position of the Ilizarov in our country. I still remember that this was really virtually unknown. The name of the Ilizarov was virtually unknown to us before Professor Bari came back to Bangladesh from Russia, I think in the year 1986. Is it, Dr. Bari? And after being qualified and trained there, before that it was almost unknown to us. It is due to the lone effort of Professor Bari that the Ilizarov technique has now gained a strong foothold in Bangladesh. Many of the Bangladesh orthopedic surgeons has made brilliant achievement on Ilizarov and practicing it in different parts of the country with immense benefit to the patients. Professor Bari, who is also a honored professor of Ilizarov Center, Kurgan, Russia, where I visited along with him in the year 2011. And I am now very much happy that Professor Bari is also a stalwart, one of the stalwarts of this technique in the world. I pray to Almighty Allah, Subhanahu wa Ta'ala, for his healthy, long, active life, along with his associates all over the world, so that the combined knowledge, experience, and technique of this is being transferred to his disciples, who may again multiply it manifolds for the service to the suffering humanity. I wish good wishes to everybody. Allah Hafiz.
Thank you very much. Thank you, Professor Shamsuddin sir. We pray to Almighty Allah that we can get you for a long time and for your long life. Thank you for your admirable speech. Dear viewers, now it's the time for the international faculty who already joined with us. Now I'd like to request Professor Novikov sir from Kurgan, Russia, to say something about the Ilizarov. From Kurgan, Russia, Professor Novikov sir. Would you please connect Professor Novikov sir?
Good afternoon. Do you hear me?
Yes, sir,
Hello,
we can hear you.
Dear friends, you can hear me?
Yes, sir, we can hear you. We can hear you clearly and loudly.
Once more, thank you very much for your invitation and possibilities together celebrate and we'll be together. This is magic day when Björn, our teacher, our father, man who give us possibilities, who give us, for me, for example, what I have in the life. And Dr. Bari very good thought about Ilizarov, about his life. I want little bit add. What is it, Ilizarov methods? This is apparatus, this is methods. Ilizarov, this is effect. Ilizarov, this is center. In Kurgan, we have street with name of Ilizarov, airport. In the sky, when we see to the sky, we can see a planet with name. And for us, just now, I see to the screen of my computer, and Ilizarov give me possibilities contact with so many great surgeons from all of the world. For doctor, this is possibilities go away from all of difficulties what we have during our job. This is efficiency. Ilizarov, this is simplicity, reliability, and this is mini-invasive surgery. For doctor, for situation, this is rigid fixation of bone fragment, early load on the operated limb. This is early function of adjustment joint and ability to manage bone fragments from moment of surgery till moment of removal frame. And for us, this is excellent situation. We can, during the treatment, can contact with patient all period of treatment. And Ilizarov methods allow the doctor to correct the all of errors and prevent complications. And I want to repeat few words from very good doctor from Iran, who spent last 15 years only for Ilizarov methods. Before, yes, he worked with different methods, and now this is what from heart. I think this is any doctor, and all of us can repeat this. Ilizarov feel any effect of life of the bone. When you are hopeless in orthopedics treatment, think to Ilizarov. Extended the quality of life by Ilizarov lengthening. When all light are off, the light of Ilizarov is on. Surprising, unbelievable event by Ilizarov. The end of disability by Ilizarov. Bright future in disability by Ilizarov. And dear friend, I want to congratulate all of us with great data, with this is excellent possibilities when we can contact with each other. And I hope more and more data in the world will use our Russian international magic, fantastic methods. Thank you very much for your attention, and I invite you, all of you, come here to the Kurgan, and you will touch this magic air really. Thank you very much, dear friends.
Thank you, Professor Novikov, sir, from the city of Ilizarov, that is Kurgan. Now, I would like to request one of our legendary professor, Professor Amjad Hussain, sir, Professor Amjad Hussain, sir, to say something regarding the Ilizarov in Bangladesh. Professor Amjad Hussain, sir, would you please connect Professor Amjad Hussain, sir, with us?
Thank you, Dr. Tanvir Ashraf. Welcome our guests, our friends from different countries, as well as our national faculties, my teacher, Professor Shamsuddin Ahmed, the director of NITOR, Professor Ghanimullah, and the chairman of the Assami, Professor Abdullah Mufakkarul Bari, actually who was the pioneer of this sort of things started in Dhaka. Basically, this Ilizarov, which we are 100 years of, or his centenary we are celebrating today, is really a very much a fantastic, for us, it is a really honor. And we have been honored and putting honor to him also, because such a man, such a visionary person, such a philosopher, and unbelievable that what he was working in a hidden place in Soviet Union, then Soviet Union, in the city of Kurgan, what he have developed. To me, if you'd have been in other part of Europe or in America, he would have been offered Nobel laureate, or he could have been a Nobel winner. But unfortunately, as he was behind the scenery, and he was in the Soviet Union, even his discoveries, what he has discovered, what he has done for the human king, this human being, is not been discovered until 1991, when he visited before New York, or one Italian who has, told about it and described about it. Let me say about in Bangladesh, this is the Kurgan you see, and I'm really very much, today, I feel nostalgic because I visited Kurgan with my teacher and others, Professor Bari and other our friends. But what has happened, I see, when we were student in RISD, then RISD, we haven't heard about the term, what is called Ilizarov. We didn't know about it. We were the students there since 90. I was working there since 81. We haven't heard anything about Ilizarov. The terminology was not in the book or anywhere. And anything about Ilizarov in Bangladesh till 1992, as we didn't know a lot about orthopedics before 1971 or Liberation War. And I was also, that I was the fighter. I was injured, so I was in Indian Military Hospital. I attended a hands-on workshop on Ilizarov in NRS Medical College, Kolkata in October 1992 by the invitation of Professor Dr. Hemant Dey, who was the head of the Department of Orthopedic Surgery and chairman of that Ilizarov workshop. That was the first time, because before that I was attending one conference, and Professor Hemant Dey, he was basically from our part of Bengal. So he's born and brought up a little bit up to intermediate. He was here. So he has got a lot of fascination. He told me, you come over here and join this new thing, which is going to be first time in this eastern part of India. So I attended there and hands-on workshop, 3 days workshop, and it was totally amazing for me. So I presented a paper on Ilizarov on 3rd BOSCON in February 1993, when today the history is this my professor Shamsuddin Ahmed was chairing the session. He also uttered that, how come this has not been seen in our countries? It was scatteredly here and there might be, but in RISD, then I can assure you that nobody was uttering his name or any his work in our hospital, particularly which was the RISD, the Mecca of our orthopedics in Bangladesh. In 1994, when I attended this AO course in Singapore, and I asked Professor Dorshev Shanskar, who was the chairman of the AO osteosynthesis, So he said, no, we don't know about Ilizarov. We don't know. What is Ilizarov? I don't know. I said, sir, it is also maintaining the biology. What you were telling today, that biology, but this is also a biology maintaining. So he said, I don't know. And you see, after that, in 1996, when I was in Madras for a clinical experience under Gopala Krishnan, who was under direct trained under the Abraham Ilizarov as a magician from Kurgan. So, and then I started Ilizarov and never looked back. In this long journey we have done hundreds and thousands of cases gradually from then on. And this is for this country, particularly for our underdeveloped countries, we had a lot of problems, which was a panacea, I should say, for our cases when failed all the cases. particularly after fixation and neglected trauma cases, neglected open fractures. Those horrible, but Ilizarov is the only answer. And of course, thanks to Professor Bari, who has tuning the whole thing, because before 2002, he could not come to Dhaka, particularly in RISD. He was accommodated in RISD or Nitor. At that time, it became Nitor. And so the things have been changed. And as we were doing scatteredly, but we are doing hundreds of cases, but he's a fine tuning he could have given to us. And this country has got a beautiful flavor from his direct experience from this Kurgan and his work with this, Russian, all the musicians, particularly Ilizarov and other people. So this is a new beginning, and we have together we helped it, Bangladesh to a next level of technologically. So let us see some pictures, which is from Ilizarov Center in Kurgan when we visited there in 2011. You see here, Professor Bari is here, and Manzul Islam and all the senior teachers also here. And you can see we were in this Ilizarov Center in 2011. We were so lucky, my wife and many of the orthopedic surgeons who have visited there. So this side, his statue is there. We still remember that statue, and we like to visit again and again, but unfortunately, because of this pandemic, we cannot visit. And this is with our Orthopaedic Society banner. We have carried this banner in that center. So we were lucky, and Dr. Bari has helped us to take over there. And we could see so many things of this musician in that center. And we have also visited many places in that Russia. And Dr. here, my friend Rizvi, Abdul Ghani Mullah, and all these people sat there. So it's really a wonderful visit we had. So, gentlemen, it is a fantastic technique, and because I am very much attached to this AO. I'm very much attached to the AO. I'm as the chair of the AO in country, and what I feel there, the stabilization and the biology. These two words are very much coincidence with this Ilizarov also. The stability as well as the biology, which is in AO also said, and also in Ilizarov said. In many cases, in the developed world, where there is advantage, they are doing it on the fixing on the very first day, second day, third day, while we are getting good cases, often neglected, often cases. So we have to use it. And I would request my colleagues all should know about it, because whenever you are putting trauma or some other cases, Ilizarov definitely has a role to play in our underdeveloped, underprivileged countries. And thank you, Professor Bari, and all these foreign guests, Professor Harsha from Bangalore, and Jiang from China, and our this Kurgan, is Constantine. Yeah, he's yeah. We are sorry. We like to visit this day. We should have visited your place. Thank you, sir, for your nice word. And we are feeling from heart that we are in Kurgan and joining with these days of centenary. We are celebrating today. Great salute to that musician. Yeah, thank you so much, and thank you again.
Thank you, sir. Thank you for your splendid and nostalgic speech. Now I would like to request Dr. Jiangcheng Jiang from Beijing, China, to share his experience regarding the journey of Ilizarov. Could you please connect Dr. Jiang from China?
Afternoon. It's okay.
Yeah, Dr. Jiang. Can you hear us?
Yes.
Yeah.
afternoon, dear friend, Professor Bali and Novikov. I'm very honored and Ilizarov. Why I came? We are many thanks Ilizarov in the important day, and I would like my slide to show through something, and in presentation, small presentation. Can you see that on my screen? Okay. Today, 15th of June, I called it's Ilizarov Day. In this year, I just talked issues of trauma. I come from Beijing, the Secretary General of Asami, China. We are Ilizarov-minded men. In this important day, we must talk some thing about Ilizarov. It's my professor. He is the president of Asami, China. He has a lot of experience about deformity and correction and limb reconstruction. Also, the honorary professor of Ilizarov Center. In our institute, we have a lot of deformities like this, lower limb or upper limb. We treat this. We got some data and published some books. Last year, we just published the new book with Springer, named Lower Limb Deformities. So suddenly, some cases show like this, some severe foot and ankle deformities. We treat it as like this. Yeah, we finally got the good result. And some patient like this, the severe deformity of foot and ankle. Patient can't work, and how to do with the patient, and in the college, no girlfriend to talk to him, and we can use our method to treat him, and finally we can got a good result like this. During the processing, we must think about how can we got the result. During the meeting, we see our friend Professor Bailey also saw similar case with us. He with the method of Ilizarov and talk about what's the Ilizarov method. And another case, the trauma case, the infection and some necrosis with some implant. Only can remove the implant, we got the good results with the bone transport. Finally, we can the closure and the alignment and the bone union and the alignment. We also have some case with the sequela of traumatic trauma. So you can see here, allowed to compartment syndrome, like this. So where we can give the insertion for the treatment, we just put the wire and frame, gradually correction we can got. So good result. And so give us some inspiration. How can we treat the original, the trauma? We prevent the compartment syndrome is very importantly. So in the treatment of the trauma case, the initial treatment is very important. The key is prevention. It's a philosophy Professor Ilizarov gave to us. So we also have some case deformity combines ulcer on foot and ankle. So we just for this kind of deformity, we established the Chinese Society only for the spinal bifida sequela. Professor Bailey, Professor Hardy Abramovich and Professor Shitu also is there. We also have some special treatment for the diabetic foot with transverse bone transport. We traveling to Kurgan Center. We suddenly found the kingdom of external fixation. We found so many professors focus on the so interesting field of limb reconstruction. We found Professor Bailey, Professor Harsney, and Professor Qin on the wall, and so on. And in the Ilizarov Museum, we found the first case of Rumir, the non-union on tibia, the processing for treatment. We got a lot of the experience about the external fixation, and in tibia and femoral and pelvic, many experience. After the discussing with the hero of Bangladesh, we called the Professor Bailey as the hero of Bangladesh. We talk a lot. We must know that what's the essential of the Ilizarov method. Yeah, this is my little son. Yeah, when we travel to Kurgan Center, we think a lot. What's the Ilizarov? When is Ilizarov? Where are we? How can we? And why is Ilizarov? And from the simple deformity, we can give Archimedes. So on the foot and ankle, we give the support and give the direction. With the force, we can go to the correction. Like this is very simple. So during another meeting, Professor Bailey said that why Ilizarov? Intelligence, lancing, infection, zig, and adaptable, amazing, opportunity, and victory. This Ilizarov. So very interesting Ilizarov in the so important day. 100th anniversary celebration of Professor Ilizarov. We absolutely must to think about what's Ilizarov, its apparatus, its mindset, its concept, its philosophy. We must say many thanks to Professor Ilizarov. And in China, in this year, we have 4 journals published. One is GOT, Journal Orthopaedic Translation. We have the special journal just for the Ilizarov technique development in China. And other 3 Chinese Journal of Orthopedics, and some Chinese journal, Bone and Joint Surgery, and some practical orthopedics journal. Totally, more than 60 papers published together. We just want to thanks to Professor Ilizarov. And in this weekend, we also have another big meeting in Shijiazhuang city of Hebei province, just south of capital Beijing. We held the Chinese Summit on external fixation and labor reconstruction. And at the same time, we hold the symposium on the humility and academy for the 100th anniversary of celebration of Ilizarov. So, and another meeting in the near future. So you must remember that in the World Congress in Lisbon, the common meeting for ILAS and Asami International, decide by voting 2023 World Meeting will be held in Beijing by us. So what a joy is to have friends coming afar. Welcome all the friends coming to Beijing to talk and to think, to do the Ilizarov thing. When I visited the Kurgan Center, in the time we visited the tube to Professor Ilizarov. We think a lot, but anyway, we will go ahead and keep going in this Ilizarov way and work hard. Thank you. Thank you for your attention. Thank you.
Thank you very much, Professor Jiang from Beijing, China. Now, I would like to request one of our legendary professor and highly academic teacher, Professor Abdul Awal Rizvi sir, as a national faculty to join with us and say something regarding the 100 years of Ilizarov. Would you please connect Professor Khandukar Abdul Awal Rizvi sir?
Thank you, Dr. Tanvi, for giving me the chance. Okay, first of all, I would like to thank Assami Bangladesh for organizing such a beautiful mixed session, scientific and non-scientific in a way. My regards to Prof. Shamsuddin Ahmed, my teacher, and other faculties who are friends of mine, local faculties, and international faculties. Many of them are very close to me as well, like Professor Ashar. Okay. Today is the 100th birth anniversary of one of the greatest surgeon of the last century, Professor Gavriil Ilizarov. He is truly a great Russian surgeon. If we look at the history, you will see hardly you will find any Russian surgeon who has been able to cross their boundaries and been accepted by the West as a famous surgeon. The exception is Professor Ilizarov. Not only that, if you see, you will hardly see any surgeon in the world who has been so well known in almost every corner of the earth today, like Professor Ilizarov. In Bangladesh, Professor Ilizarov is very famous, and he is very close to us, dear to us, because in Bangladesh, almost all the trauma surgeons, when they are in trouble, in fixing difficult fractures, they resort to Ilizarov system. Because in many of our areas, we have poor physical settings. So in that situation, Ilizarov can be only hope. In my whole career, in orthopedic career, many occasions I've been get over difficult situations by the Ilizarov system and his teaching. So I am personally grateful to Gavriil Ilizarov. He has left us. He is no more with us. He left this world in 1992. But if you look at the world now, his presence is much stronger.
Recording in progress.
His presence is much stronger and greater than before. So, my tribute to him, and I pray for his departed soul. With these few words and my tributes, I would like to conclude my speech. And before that, I would like to thank all the faculties, foreign faculties and local faculties for their participation. And thank you again, Dr. Bari. Bari is the ambassador of Ilizarov in the world now. And because of him and some of our young Ilizarov surgeons, Ilizarov system is now improving and developing much faster in Bangladesh. So my personal thanks to Bari as well. He's a close friend of mine, personal friend. So we are proud of you with these words. And Goni Mullah is the Secretary General of Assami. Goni Mullah, thank you for organizing this program. And also my thanks to Bangladesh Orthopaedic Society for facilitating this program. And these words, thank you again. Thank you, Hasrat. Thank you, Jang. Thank you, Russian Professor. Okay, Professor Amjad. And I cannot see so many friends. And also my special thanks to people who have been connected. Thank you.
Thank you very much. Thank you, Professor Gavriil Abramovich Ilizarov, sir. I would like to thank Raj TV and OrthoTV for transmitting our program. And you can connect us on Facebook. And it's a great honor for us that OrthoTV is with us. I'd like to thank the OrthoTV team as well as the Raj TV team. Now, I'd like to request our international faculty, Professor Harshad sir from India. Would you please connect Professor Harshad sir with us?
Recording in progress.
Thank you, Mr. Tanvir, Dr. Tanvir. Is it shared? No. Share screen. What is coming? Okay. Can you see my screen? How do you do this? No. Huh?
Yes, create a screen.
No,
So go to slide mode.
Big screen.
Go to slide mode.
Okay.
Yes. Yeah. Good. Screen.
This is okay?
Sir, please go full screen, sir.
This is okay.
Yeah, 80% okay, sir.
1 second, one
Recording stopped.
Make it full screen, sir,
Now
please.
is it okay? Full screen. Okay.
Yeah, 100% okay. Perfect, sir.
But these photos are coming in the way. Okay, fine. Sorry for this little bit, this one. I'm an Ilizarov surgeon, not an electronic surgeon. I should thank our young and handsome man, Tanvir, for allowing me and calling me here onto this. I envy him. I prefer his job to my job. This Ilizarov technique is a very, very, very simple technique, but at the same time, it is treated for the most complex cases. Hence, nobody in the world wants to do Ilizarov technique or learn this technique initially. But once they learn, they will love it.
Recording in progress.
Raj TV and OrthoTV also for all these things. And I'm amongst my oldest of friends, Dr. Bari. I started with him, and then Dr. Skonkar, Dr. Amjad, and also my pranams to Professor Shamsud Ahmad. And after Professor Ilizarov, I came to know, of course, I have not met Professor Ilizarov. I wish I had. I came to know Professor Shevtsov and finally Dr. Novikov. So, my namaskars to Novikov, and Jang has been a close friend for a long time. So, ladies and gentlemen, today is the 100th year and birthday of Professor Ilizarov, and I should congratulate Dr. Bari for conducting not only one day, but for a whole month. This one, we envy that. Feel sorry we are not in Russia at this time. Otherwise, 100% would have been in Russia. As for this corona problem, this was conducted last year, and I mean last time, and these were all the people who were there. We had a video, and this time today it is going to be our experience and journey. I forgot Dr. Abdul Ghani Mullah, a very, very close friend of mine after Bari, and we have had a long, nice association. I have been in Bangladesh for more than 10 times for all Bangladesh meetings, Assami meetings, as well as their annual meetings. Today we have a big number of people on the TV, on Raj TV, with all these people on the list. Professor Ilizarov, no doubt, he should have been awarded the biggest prize in the world, and I do not know which is bigger than Nobel Prize. If there was something, he should have got it. Otherwise, he is the one who has probably discovered the best thing in orthopedics. Everybody puts implants this, that, everything is there. Of course, everything adds to all the history. But what he has discovered is generating new tissue. That is known as histoneogenesis. All the tissues. If it is bone, it is osteoneogenesis. If it is muscle, myoneogenesis, etc., etc., etc. So when you stretch a cut bone, the skin, the muscles, the nerves, the vessels, and the bones, everything grows. Everything has its own time to grow, but everything grows. And this was basically discovered. And not only discovered, the whole thing has been standardized by him for at least 20-25 years. From 1951, when he invented his rings, he started doing this, and it came out into the world only in the 1980s, late 1980s. So imagine from 1951 to 1985, 35 years, he has been working with this in all the labs, all the tests, everything has been done ready-made for the whole world. The whole world has improvised a little bit, a very wee little bit of probably 5 to 10% of what Professor Ilizarov has done as one man. Of course, Professor Shefso was with him, and I should say namaskar, namaste, good afternoon to all. I come from Ramaya Medical College, Bangalore. Office, please. This is my old hospital, which looks like a palace. I'm in Medical College building, which looks like a palace. They wanted to bring the front part of it, has come down and is being converted to a university. But I prefer these kind of buildings than these routine buildings. What are there everywhere, from China to USA to Europe to Australia, etc. Professor Ilizarov's rings. Somehow I managed to get this particular ring here, and this shining thing came like the eclipse, and this has changed the whole world of mine. The Ilizarov Center, a lot has been told about the Ilizarov Center and Professor Ilizarov by everybody. After that, Professor Shefso has been my mentor, and he has been the director for Ilizarov Center for 25 years. That means almost half a decade or more. Professor Shefso has been with Ilizarov as well as with this, and I'm very fortunate to learn with him and then be faculty with him. All thanks to Bari as well as our other people in India. There he is. We have very good light moments with him, and he is so young with us. And in spite of being so old compared to us, he is much more stronger, and he operates for 5-10 hours continuously without getting tired. Such a great man. I get all inspiration from him. This is in the first International Assami Conference which Bari conducted. I was there. And he also sometimes gets some beautiful secretaries. That glass which he has put has been gifted by me, which was for her when I knew that she is coming. Now, after that, Professor Alexander Gubin, he had become a very close friend of ours because of, again, going to Russia a few times, and then Dr. Borzno and many, many, many more. Like Professor Novikov, who was the latest friend of ours, other than Catania, etc. The Chinese have been meeting us, Dr. Zhang particularly, and then Dr. Quincy Hay, Professor Quincy Hay, and in all conferences across the world. And we became very, very close friends with them, with many other people. All the names seem similar. And then they called me to China, and what hospitality, what beautiful this one. Their hospital, the government has helped them so much. I wish we had a government of their kind. I wish we had patients also of their kind. We do, of course. China and India are having the same population with the same problems, and we could treat all these patients with this one. And all of them get together in China, Malaysia, everyone. All of us are almost the same international group everywhere. You can see Zhang is there, Dr. Quincy is there, Kamal Hosni is there, Sohaik is there, I am there. And of course, Bari and everybody will be there all the time. You can see here, again from Malaysia, from India, from abroad. Bari is there, and Malaysian. Dr. Ghani. What we see him today is totally different compared to what we see him then. And Dr. Abdul Ghani, with a strong Amitabh Bachchan kind of voice, has been a great inspirator for not only treating Ilizarov patients, but also for some kind of administrative advice, political advice that I got from him. And accordingly, I have seen to it that I have implemented here. There I have conducted Ilizarov cadaveric workshop also. So every single pin, how it is to be applied, every single half pin, how to apply, how to fix the rings onto different parts of the leg. All my postgraduates, consultants from across the country and world attend these meetings. Invitations are given to the best of people across with a large faculty. So if we have, say, 30 candidates whom we train cadaveric workshop, we have on each table only 2 or 3 students, and we have 1 or 2 faculty for each student. And each one of them gets so personalized training that they can go back and do surgeries on simple cases like tibia fractures, compound fractures, by putting Ilizarov surgery, because they have learned here within 3 days of time. It is not so easy, but then it is not so impossible. Of course, my salutations, other than the Professor Ilizarov, Professor Shevtsov, Professor Novikov, to also outside people like Professor Dorpel. He is the one who has simplified my Ilizarov by saying that complications are minimized by changing the nomenclature. And of course, the specialty of Ilizarov, limb lengthening and reconstruction, has been expanded to treat all these difficult conditions by even different methods where possible, or combined methods. There, Professor Bari, we both are like elder brothers and younger brother, or younger brother and elder brother, both are same age. And Professor Novikov is here, who has been with us in Bangalore for the cadaveric workshop and done some surgeries and helped us a lot. He has operated on my family. And we have in our medical college Professor Sandeep Reddy also, who does Ilizarov surgery with me, of more than 15 to 20 years experience. We have Dr. Ashok Kumar, who has got 15-20 years experience. I have trained more than 200 people, and we have done conferences, workshops, cadaveric workshops, CMEs, live surgeries, webinars, etc., across my country. You name the city, most probably we would have done some workshop or meeting or the other. This is what I have learned. I have mastered Ilizarov technique to some extent. But then Ilizarov has got 15 departments under various specialities of Ilizarov. For infection, 3 departments. For deformity corrections, for limb lengthening, for pelvis, for spine, for hand and surgery, upper limb, lower limb, etc. So when all those are specialities which are treated by Ilizarov external fixator, I am just a general orthopedic Ilizarov surgeon, where I treat all of them to a large extent. And probably I don't know how to treat many of them. And we will have super specialties under Ilizarov also in future, just like Russia. I think Russia is the only country in the world which has got more than 800 beds, which has got departments of 14 or 15 departments, where each department sticks to its specialty of orthopedics. Like pediatric orthopedics is a department like that. But we here are individuals who try to do everything. So it's not very simple for us. This was the Ilizarov workshop, photograph, the whole workshop, cadaveric workshop, which has been put in Dr. Bari's nursing home. He's one fellow, you go from top to bottom in his hospital, you'll get photos of everywhere across the world. That was in Brazil. I have also traveled across the world more than 70 times, I think. And the biggest conference which we have conducted is when Professor Junjunwala was the Assami International President. I was one of the organizing vice presidents that time, and people from across the world were there. Some of them who were here are there, and we had a wonderful time and one of the best conferences held across the country. I think the next conference will be with Dr. Jiang in 2023, and probably you should not miss it. They will do it in a fantastic way. This one was to keep on training everybody. Like I told you, I have trained more than 200 doctors, postgraduates, foreigners, etc. We have presented more than 300-400 papers across the world. So that helps us to learn more and more and more about Ilizarov. And Professor Ilizarov's book has been my Bible, my Quran, and my book on my Mahabharata and my Ramayana. Because every time we go into it, he's got hundreds and hundreds of illustrations, line diagrams, which make things very easy for us. And of course, Professor Bari's books, all of them are with me. Many of them are there, and there are many other books written by many people. My aim is, of course, to see that this Ilizarov method comes into our postgraduate curriculum so that all postgraduates will be able to learn at least the basic Ilizarov technique so that they'll be able to teach and treat patients later in future, learn better, either in Russia or our centers or Dr. Bari's centers and all that. A few cases. Infection, I was telling, is one of the worst dreaded problems for orthopedic surgeon. Any fracture, any problem, you put an implant, you may get. When you get infection, you cannot put any implant. So what happens? Such particular infected cases or congenital cases, you can put Ilizarov. Some cases I'll show you. We'll talk about infection later. A few cases only. Here you've got cross deformity, cross shortening, no bone growth in between, poor bone growth of one. So when you have so many problems in these things, it is impossible to treat conventionally. It is not impossible, but it's very difficult and you will not get good results and failure rates are very, very, very high. So this is one condition where Ilizarov is the only method of treatment and the best method of treatment. There are new methods being devised by everybody every day. The world technology keeps improving. But you can see such a small leg, such a deformed leg has become straight and the child has become normal. This is known as congenital pseudoarthrosis of tibia. So a lot of congenital cases we get. How do we do limb lengthening? All of them, Dr. Jhang, others were saying, limb lengthening is done gradually. The tissues grow by 1 millimeter per day. So if you have 10 centimeters, it will take 10 months for the limb to grow 10 centimeters. That's the minimum. And it will become normal. A short leg, short femur, broken femur, deformed femur. I'm sorry, I'm not showing so much because of time. There it is deformed, the hip joint. We have treated this. I have created special pins for this with stoppers. And then that's the leg. You can see the leg has been cut. We call it as osteotomy or corticotomy in two sides. And finally, this girl's leg has become so long. There you can see, that is the X-ray. From top to bottom, the whole thing is one leg. You can see there, that is the hip joint, that is the hip joint. The knee joint in this normal leg is here. The knee joint in the normal leg, other leg is here. So look at the difference. And that leg has been grown 26 centimeters. Right? That is the way. Walking normally. Yeah, anything. Deformed forearm. You can see short forearm, one of the bones. Long forearm. We have cut in two places, put some wires inside. And from that kind of situation, she's become normal. A relative of mine who came all the way from Maharashtra got it done in my village. Very, very crooked limbs and all that can be made straight. There are plenty and plenty of cases to show. Now you can see this small video. This is the most ghastly thing that we can have. There is a lot of infection, no treatment possible. This patient had come, okay. Most of our patients with infection have this problem. No bone, they'll have gaps and they will have abnormal mobilities and 50% used to go to amputation before Ilizarov came. Once I learned Ilizarov surgery helped in curing all these patients. There you are. The whole thing is grown. The bone has been regrown. And this is the boy. He had infected non-union in this whole area for which he had spent 1.5 crore rupees in USA when he was there. When he came back, he searched for me and then fortunately I could cure him in only 25 lakh rupees. The whole thing after doing 5 surgeries. But then he's totally normal now. That is his X-ray. Nowadays, some more additional things are being added. This is computerized deformity correction device known as SUV 6-axis. This was done by Dr. Solomon, also from Russia. There are TSF, other things of this kind. Well, ladies and gentlemen, this is only a small introduction, a small story for you all. The Ilizarov story is so big that a whole orthopedics can be super specialized into Ilizarov methods and Ilizarov treatment, basically for limb lengthening, for correction of deformities, and for infected non-union and gaps in long bones where of any cause. We can regrow the bone by bone transport as well as limb lengthening. Spasiba, shukriya. Thank you so much. I love Ilizarov very much. He's been my passion. I love Bangladesh also. And I thank everybody. And I thank Raj TV and Ortho TV. And finally, our handsome young man again, Tanvir, for allowing me to talk. And final best thanks goes to Dr. Bari. 3 cheers to him. Thank you so much.
Thank you, sir. Thank you for your splendid speech. And we all love you also, sir. Now, I would like to thank OrthoTV for telecasting our program. And definitely, I would like to thank Dr. Shamsul Huda to act as a coordinator in OrthoTV. Now, I would like to request Dr. Shamsul Huda to join with us. Would you please connect Dr. Shamsul Huda? I think he's facing some sort of network problem in their countries there. Now, I would like to request Dr. Shamsul Huda to join with us, the Joint Secretary of Assam, India. Would you please connect Dr. Shamsul Huda to join with us? I think he's facing some sort of network problem there. I think we better connect him in the next part, as because of we are in short of time. Now I would like to request to present a magnificent presentation by one of our magnificent young Ilizarov surgeon, Dr. Miraj Mullah. I would like to request Dr. Miraj Mullah to present his presentation.
Assalamu alaikum, good morning, and it is a great privilege to present something in the occasion of 100th birthday anniversary of legendary scientist Professor G.A. Ilizarov. I am Dr. Mohammad Mirajuddin Mullah, a junior orthopedic surgeon working as an Ilizarov surgeon. It is not actually a presentation, it is my proposal that the history that Ilizarov has brought a revolutionary and radical change in the subject of orthopedics. But there was no solution except amputation. Now there is every chance of limb salvage and functionality. So to my opinion, total orthopedics can be divided into two eras, pre-Ilizarov era and post-Ilizarov era. What we used to do in the pre-Ilizarov era, we now don't do it in the post-Ilizarov era. So orthopedic surgery textbook also can be include this. The Ilizarov comprises basically two things, the Ilizarov technique and Ilizarov devices. In technique, revolutionary changes in bone and soft tissue biology and regeneration have been introduced. And Ilizarov device, it is a multiplanar, versatile fixator. Even we can consider it as a dynamic implant. What we do in a Bangladesh perspective, I wanted to show you something. The distraction osteogenesis, it is a comparative, actually, the comparative study, the comparative analysis. What we used to do for distraction osteogenesis for bone lengthening. In pre-Ilizarov era, we used to do oblique osteotomy. Sometimes we put bone graft in this, but it had limitations. There are growing nails after recently developed, but not available in Bangladesh. So we can forget about that. So in after the advent of Ilizarov, now we know how to lengthen bone. There is no limitation. We can lengthen it 3 inch, 4 inch, 6 inch. There is no limitation. In infected non-union, it was a nightmare for orthopedic surgeons. No implant could be used. Some used antibiotics, cement spacers with unilateral X-fix. But nowadays it can be easily managed with excision of all dead bones, making a gap, and bone transport with Ilizarov corticotomy. Like this one, you can see in a very bad case of humerus, what has been treated by Ilizarov. Open fractures, in Bangladesh, it was very difficult to fix earlier. Usually we applied unilateral X-fix, which later became non-unions. But after the advent of Ilizarov, we can use it as a definite primary and definitive fixation device. Some aseptic non-unions were very problematic before Ilizarov was discovered. We have to use multiple surgeries was done, but still non-union occurred as those are avascular type. But now we can excise as much avascular bone as required and transport bone with corticotomy. There is no problem with doing that. Deformity correction has, with Ilizarov, deformity correction has become very much easier. Bone deformity can be corrected. Earlier in pre-Ilizarov era, some osteotomies were done, but the soft tissue were very difficult to manage. Extensive release of soft tissue made sometimes amputation was also required. But after the advent of Ilizarov, the gradual osteo and after corticotomy and osteotomy, using the open waste principles without any bone graft, deformity can be corrected very easily. And joint and soft tissue contractures are very easy to correct without any release of soft tissue. Like this one, you can see a bad case of pterygium earlier tried to correct with vascular soft tissue release, but failed. Then it was easily corrected with Ilizarov. Difficulty fractures, there are some difficult fractures which have very little space for screws and plates. The risk of skin blowout and also amputation was required for this type of fractures. But with Ilizarov, this fine wire technique, actually which is an Ilizarov technique, is very easy to manage, and it can also be used as joint spanning fixator. Ligamentotex is very much easy with this device. So many very difficult fractures can be managed with Ilizarov also. In Perthes disease, we have done some cases here in Bangladesh. Earlier, it was done with varus derotation osteotomy mostly, which were a younger age group, and which in those there was enough time for remodeling. But for older age group and severe case, there was nothing to do actually. But after Ilizarov era, with arthrodiastasis, we can achieve greater remodeling even after the age of 11 or 12. This improves a lot of hip function and preserves the joint. You can see this was a bad case of a 10-year-old boy, which was arthrodiastasis was done, and now there is a good remodeling of the femur head. Osteoarthritis, even in osteoarthritis, Ilizarov has great role. Like high tibial osteotomy we do in earlier, but very difficult with plates and screws as there was little space for holding the screws. But with the Ilizarov device, high tibial osteotomy can be done very easily. And there is also some study that it is actually an avian osteoarthritis. So some wires, if put in the femur reaching the subchondral bones, can increase the blood supply and increase the chondrocyte and cartilage. In PVD, there was though it is not an orthopedic subject, it is a subject of vascular and general surgery, but Ilizarov has role in this. Our Professor Bari have done lots of Barthes disease. In pre-Ilizarov era, it was usually treated by bypass graft, but for small vessels, there was nothing to do. But nowadays, we can do tibial widening, which increases lots of metaphyseal and interosseous blood supply. And so the limb can be salvaged. Cosmetic height increment. Before Ilizarov, it was not possible to gain height after skeletal maturity. And nowadays, it is developed, some intermedullary growing nails are developed. But after Ilizarov, it occurred actually. So now any height can be achieved by any person. There is no limit of age. Though Bangladesh, there are few cases, but worldwide the number of cases are rising. Like this boy who has gained 3 inches. Arthrodesis was a difficult job earlier. Failure rate was high, difficult in presence of infection. Charnley device was used in knee and ankle. Sometimes internal implants were also used, but after Ilizarov, it can be applied as joint spanning fixator. So arthrodesis has become very easier, like this ankle. This is an important aspect of Ilizarov to reconstruct tibia. Most in pre-Ilizarov era, long gaps of tibia was difficult to manage, but now any part of tibia can be reconstructed with the help of horizontal transport of fibula. You can see this one. Ilizarov in spine, there are lots of prospects, but in Bangladesh only Professor M. Bari has started this in some cases of PLID and bust fracture. Scoliosis can be corrected with Ilizarov. Thank you. Thank you all.
Thank you very much, Dr. Meraz Mullah, for your excellent presentation. Now, I would like to request one of our very renowned professor from Nittor, Professor Jahangir Alam sir to say something regarding his journey to the 100 years of Ilizarov. Professor Jahangir Alam sir.
Thank you, Tanvir. And today is that day when a great orthopedic surgeon of the world, a magician of Kurgan, came to this world, and during his life, he served the deformed, infected, and neglected orthopedic patients, and he is delighted to the whole world by his work. In our country, we have learned from many things from Ilizarov through our great Professor M.M. Bari and Professor Dr. Muhammad Abdul Ghani Mullah. Initially, when we are the resident of this institution, when everything is to failure, like infected non-immune, then we have planned for that treatment by Ilizarov, and many people got benefited from this method. So I have to honor every people of the world who are dealing with this magic treatment in this 100th anniversary birthday of Ilizarov. Salute to everybody from Bangladesh Orthopaedic Society and Nature to treat such complicated patients like deformity, infected non-immune, and where some treatment is failed. And I am ending my speech again. Salute to our great Professor Bari, Professor Abdul Ghani Mullah, Professor Harshad, our close friends of Bangladesh, Professor Rizvi sir, Professor Shamsuddin sir, and who are live in this program. Thank you, everybody from our institution and our society. Thank you.
Thank you very much, Professor Jahangir Alam sir. Now, I would like to request our technical team to join all the members who are with us in silent mode. Please make them unmute. I would like to thank all the members who are with us. Before I go into that part, I would like to request Dr. Shamsul Huda to say something, which is Dr. Shamsul Huda from OrthoTV.
Hello, good afternoon. Can you hear my voice?
Yeah, we can hear you. Please proceed on.
Yeah, thank you. Yeah, thank you. Thank you. Very good afternoon, Dr. Kamir. Thanks to Assami Bangladesh to give me space to speak at this grand moment of 100 years of Ilizarov. I would like to give regards to our mentors, Professor Mbari sir, Professor Harshad sir, Professor Novikov sir, Manimullah sir, Shamsuddin sir, Professor Jang sir, and my friend Dr. Tanvir, Dr. Shetu, and Raj TV. Ilizarov has been like a long journey for me. A few years back, I used to do routine complex trauma surgeries, tremendously due to lack of a technique which can treat all impossible cases. Or amputation would have been an option. And I felt need of an advanced training to treat these cases, these patients, to treat here at Mancheri. So I joined Assam India, learned from different faculty and courses. I learned from Dr. Harsha, Dr. Junjanwala sir, Dr. R. Agarwal sir, Dr. Munir Sawan, Dr. Ruta Kulkarni sir, Dr. Milind Chaudhary sir, Dr. Suresh Bhola sir. my Patna's mentor, Dr. John Mukhopadhyay sir, Dr. Prakash, and of course, Professor Bari sir always guided me in every moment. And then I went to Baltimore, USA for advanced reformative courses under Dr. Hasenberg, Michael Asayag, and other international faculty. I learned different techniques from Dr. Shirso, Professor Novikov, Dr. Solomon, Dr. Victor, Professor Gamal Hosni, Dr. Hamuda, and many more, Professor Faisal. And then with learning, I became Joint Secretary of Assam, India. To go ahead. Now I'm treating the magic of Ilizarov various cases like complex bone infection, limb lengthening, deformity correction, and master the art of bone and tissue regeneration. I haven't seen Professor Ilizarov, so all my mentors here. I'm face of Professor Ilizarov here. So when you surrender treating with conventional orthopedic surgery, the magic of Ilizarov, he is all impossible cases to normal with principle of biology. Thanks. Thanks from with love from India. Thanks a lot.
Hello. Now, I would like to request our technical team to join all the members who participate with us in Zoom ID. Please show them in the screen so that we can identify. Yeah. Is it from? Are you from China or are you from India? The right one, the spectacles ones. I can read out your name clearly. Can you hear me? The right one, the most right one, the second right one.
Me?
Yeah.
Oh, okay. I'm Chayanin from Thailand, Thailand Assami Group. Thank you for the
Recording
invitation.
in progress.
Thank you for the invitation to join this this meeting. It's my honor, and thank you to the organizer and the host of this meeting. Yes, I think Ilizarov apparatus and its application are a very valuable treatments for the mankind. I hope that we will have this activity as the regular events in the future. And if you want my assistance in this activity, please do not hesitate to contact me. Thank you.
Thank you very much for joining with us. Now I'd like to request the middle one, the middle senior person. We cannot read out your name. Would you please raise your hand and tell your name to us and say something? The middle man in the screen. The technical team, would you focus the middle person in full screen, please? Dr. Vikash Kumar. Dr. Vikash Kumar, sir, please. Would you say something? Yeah, good afternoon, sir.
Good afternoon to everyone. Thank you. I'm the student of Ilizarov, student Ivanovich in Russia. I finished my orthopedic at Russia, 1 year course there. So I got the chance to see near to Kuragan, and thanks to Ilizarov, 100 years we have celebrating today. Thanks again, Magic Man. Spasiba za Inoi.
Thank you very much, sir. Thank you very much for being with us. Now, I want to hand over the microphone to the prestigious person, those who are participating in this program. And I would like to give our thanks. I would like to give our thanks to them. If anybody want to say something, please raise your hand and you can connect with us. The floor is open for all. you can share your experience with us. Okay.
Rajiv, you've been Ilizarov for a long time. So you please go to the dais and say something. Please, go to the dais. You know, next, Shatu.
Sorry, I had a bad network. I just came to network now.
Assalamu alaikum. I'm Dr. Raju Ambit, working in Nitur as a junior consultant and working in Ilizarov unit for last 5 to 7 years. First of all, I especially thanks to my recent mentor, Dr. Nazmullah Shedu sir, because he is reminding me first that this 15 June is 100-year celebration of great Ilizarov surgeon. Great Ilizarov surgeon, Mr. Professor G.A. Ilizarov sir. Now I want to say something about Ilizarov. With Ilizarov, where we are in past, those limb what is going to amputate, now we can save this by this Ilizarov, and especially very much especially acting in infected non-union and deformity correction. And especially I do many deformity correction with this Ilizarov, like congenital talipes equinovarus and equinus foot, CPT, congenital pseudoarthrosis of tibia, and like genovarus, genovalgus, many different deformity cases, and apply a lot of Ilizarov. Apply some Ilizarov in many failure cases also, like infected non-union in femur, tibia, and radius ulna also, and humerus. So I can say it shortly that Ilizarov give us a new era in orthopedics. In orthopedics treatment, and it is a vast. If you want to do Ilizarov, this is a very vast answer. For this, I welcome you all, especially young surgeon like me or my juniors, to join Ilizarov unit in Nitur. And I am encouraging all of you that you have to give some time in Ilizarov unit with us. Now, I just thanks especially to our Professor Bari sir for the mentor of all of us, And lastly, I special thanks to my unit chief and director, Professor Abdul Ghanimullah sir, for arranging such a beautiful and conducting meeting in Ilizarov. Thank you, sir. Thank you so much.
Thank you, Dr. Rajiv. You are doing the Ilizarov for a long time. So you can say something in this August gathering. So thank you very much from the core of our heart. Now, I would request Dr. Shetu, the mentor of Dr. Rajiv. Dr. Shetu is the assistant professor, and he's the key person now in actually the Nitur. So I think Dr. Shetu, you please say something.
Yeah. Assalamu alaikum. Thank you, sir. At first, on the eve of the 100 years birthday celebration of Ilizarov, our mentor, Professor Bari sir, our director sir, and our teachers in front, our audience. Assalamu alaikum. At first, I grateful and thankful to our participants, our great teachers, Amjad sir, Rizvi sir, and Kori sir, and outside of our country, Novikov sir and Harsha sir also, and from Chin, Zhang sir. Thank you all, and enlightened our program for this session. And also, I thankful to our director sir for encouraging us to organize this session very nicely. And on the from our Bari sir, we learned from him the Ilizarov method and its applications. Now we can disseminate the method to our followers and to the learners. How to correct the deformity, how to bone transport, limb lengthening, and etc. It's a magic, and it's a magic of Ilizarov. And without Ilizarov, we cannot think about this today. And now we see that a lot of people are coming and learning about this method. On the eve of the 100-year celebration, we again thank to our great scientist, academician, Ilizarov, and thank to our sirs. Thank you all. Thank you.
Thank you, Dr. Najmul Huda Shetu, and definitely my friend, Dr. Kokon, for his nice speech. Now, I would like to request for the last presentation from our Honorable Director, Sir, the President of Bangladesh Orthopaedic Society, and the Secretary of ASAMI, very prestigious Professor Dr. Abdul Ghani Molla, Sir. Professor Dr. Abdul Ghani Molla, Sir.
Again, Bismillahirrahmanirrahim. Today's president, the president of Asami Bangladesh chapter, Professor Mofakrul Bari, our big guys in the field of orthopedic era, in the field of Ilizarov India, not only in the country, but also in the world also, not in the subcontinent, but in the world also. He was our inspiration. He was our mentor. He was our great teacher. And he dealt the complicated cases in such a way that in Bangladesh, there are many Ilizarov surgeons in the country, and they are helping the patient, helping the mankind in this regard. So, 100-year birth anniversary, I salute from the core of my heart. But before him, many of the Ilizarov surgeons in the country, Professor Abdul Samad Sheikh, or ex-director of NITOR, he died, he has been gone to his great majority. That is, he died 2-3 months back. He was our director of NITOR. He started in Ilizarov, in the periphery region in the country, particularly in the Rampur, in the Borishal. He started, and he also started in the Ilizarov, in the RSD, then RSD, now NITOR. He is no more in the country. So may Almighty Allah bless him eternal peace. The second guy, he was also our mentor in the different aspect of the orthopedic surgeon, Professor M. Jamjad Hussain, the war-wounded freedom fighters in the country. He was a great freedom fighter. He is the man who has a good hand in all the branches of the orthopedic surgery. Particularly, he started in Ilizarov. When he started in Nitor, many people are laughing. When Professor Abdul Samad Sheikh has started their invention for the sake of the Homo sapiens in the country, then everybody laughs. So, Professor Amjad Hussain, he has a good hand to all the super specialty of the orthopedic surgery. Where he is not. He is in the Ilizarov, he is in the hands, he is in the general orthopedics. Now he is in the great replacement orthopedic surgeon in the country, hip and knee. So I saluted in this August gathering and in this August day, Ilizarov Day, 100 years birth anniversary of Ilizarov Day. I also remembered that two guys. So, but after coming back from Russia and after coming back to Nitor, particularly in RSD, when Professor Bari is coming, Ilizarov is everywhere. And he invented the Ilizarov from the core of his heart when he was also controversial throughout the country by the senior and junior doctors. But now he is the reputed, he is the mentor, he is the philosopher, what not. But he was also a controversial man in the country in the field of Ilizarov. So, Gavriil Ilizarov is also controversial in his time also. He was the cock by the doctors. He was called by the cock. He was called as a cock when he invented this frame, this method of Ilizarov in his country in the last part of 40s, I think, or first part of the 50s. He was called quack doctor, you know, everybody you know, quack, Hathuré doctor. Also, he was born in Poland in a very less developed, in a Jewish family, in a very poor family. And they came to Russia and settled in Kurgan for their maintenance of the family. He was educated and he was becoming a doctor and becoming an orthopedic surgeon. Just after Second World War, there are so many injured people in his country. You know the history of Second World War. I don't want to go that side. Still, in the 50s, 60s, and 70s, in his own subcontinent in Europe, his method was not accepted by the senior doctors. First of all, in Italy, maybe, the Cadagni, he was a great orthopedic surgeon and great Ilizarov surgeon. He was the man who followed the rules and regulations made by the Ilizarov. And you are here to know, in 60s, 70s, and the 80s, a whole Europe, the Ilizarov method was popularized. In America, United States of America, it was not popularized before 90s. Can you understand? আপনি একটা আবিষ্কার করবেন আর সেটা পপুলারাইজ হতে এতদিন সময় লাগবে. This is the sadness in the part of the inventor, in the part of the inventor, in the discoverer. So now Professor Herzenberg, Professor Dorpale, they are the renowned orthopedic surgeon as well as the Ilizarov surgeon all over the world in the deformity correction. Now in the field of our country and our subcontinent, when Professor Shevtsov, the second man of the disciple of Ilizarov, Professor Gavriil Ilizarov, Shevtsov is coming to the country by the invitation of our mentor, Professor Bari. we are inspired, our country is inspired, our orthopedic surgeons are inspired, and we have a hope, we had a hope, and to continue our hope for the sake of the people. And in the subcontinent, in the world also, he is the second man of Shefsov. He is the very nice interpreter of Shefsov. And that's why honored Professor Bari is not only in his country, he is congratulated, he is the good teacher of China, India, and also in Europe. So I saluted in this Augustan to Professor Bari sir also. The paper gulo ase. So Ilizarov method, you know that I don't want to go. I don't want to go to Ilizarov. This is a fractured femur. You please see. And the orthopedic surgeon had done open reduction, internal fixation in such a way, the nice presentation, nice operation. But what is the fate? This is the fate. This is a huge pass was there. You know that there is a huge pass was there. And there is no, from the orthopedic side point of view, what you are doing, what you want to do. You just remove all the things, debride, and wait for the months together, years together. But if you have a hand of Ilizarov, please go on. You can something, and you will be great pleasure that you have. And ultimately, the man is now okay. Still, for last 3 years, he has been put the Ilizarov frame in situ in his femur. That's a so. There is a long bone, there is a humerus, implant failure, there is a pus, discharging sinus ears for months together. What you are doing? Again, something. I am very much interested for the infective non-union, and I have no sleep in the night when I am going to do some operation in this regards. And very interesting, but you have to be patient, and you have to be known, education, known, and you have to know the safe zone of also, the particularly the long bones, safe zones. This is the distal part of the pylon fracture, open pylon fracture, and our orthopedic surgeons are doing like that. What will be the fate? At least you can do something by the Ilizarov. Deprive all the bad things, all the sequestrated things, and putting the Ilizarov in such a way. And corticotomy, why there is a bone loss, no problem. This is radius ulna. It is also the problematic and the complicated case in the field of Ilizarov surgeons. And if you know something for the radius ulna and Ilizarov method, you can do something helpful to the patient. The patient is very happy. Still, the frame is here and it is united. Still, I kept the Ilizarov frame in her hand. So, Ilizarov method is not only for the union, infective non-union or gap non-union in the field of orthopedic branch. It is familiar. We are known from Novikov, known from Govin, known from Shevchov, known from the great teachers like Professor Singh, Professor Harshad, and many other friends in the country, that they are applied the Ilizarov apparatus in the urology in neurology and other subject also. We have an agreement to the Kurgan. I think the Kurgan people are here. The Russian people are here. Professor Novikov is here. We have an agreement to the Alexander Gavin, the great teacher and now the director of RISC and RTO. And the previous to him, Professor Shepsov is here. We have an agreement between the Kurgan and the Nitor that our junior colleagues, our Elizarov surgeons will go there, visit there, and also learn something from them. So in this Elizarov Day, 100-year birth anniversary of Elizarov Day, I would like to mention and to remember that days, that in future, this agreement will be followed by the present administrator. Now, not only the Kurgan, Professor Bari, sir, he has conquered, not only the conquered Bangladesh, he has conquered the world. So now the world is in your hand. Dr. Jahangir, please attend to me. Now, the world is under our hand. But there is Professor Bari, India is with us, Russia with us, China with us, Egypt with us. So it's our pleasure and it's our, I think it's our pleasure that Professor Harshad, you are under us, you are under Professor Bari. So you are in Kurgan, Professor Novikov, in Cheng, in Thailand, Mr. Doctor, you are here also. So I think, Amjad sir, what I want that you may understand. Now, the world is under Bangladesh in Ilizarov and under honored Professor Bari. I salute you, sir. Last of all, the people, the man who is behind the Ilizarov, he is Gavriil Ilizarov. The man behind the Ilizarov is mentioned. He is the philanthropist, the philosopher, he is the great academician and magician of Ilizarov. He is Professor Gavriil Ilizarov. He is no more in the world. We pray to Almighty for his eternal peace. And the method, Ilizarov, আপনার যেটা দরকার, before his death, Kurgan Center কিন্তু নাম হয়েছে তার পরে। Kurgan Ilizarov RISC RTA, এই যে নামটা Ilizarov সাহেবের নামটায়, after his death, the center was named as RISC and RTO, that is Kurgan Ilizarov Center, and Ilizarov and RISC and RTO. So in this birth anniversary of our great teacher, our great inventor of the world, Professor Ilizarov, I would like to remember you, your family, and your invention for the Homo sapiens in the world. And I'll be very happy if our audience, those who are connected with us, the great teachers of Ilizarov, and also our disciples, you are in front of me, and all over the country it was telecasted. So those orthopedic surgeons, Ilizarov surgeons are connected with us. Please doing help for the people. আপনারা দুনিয়াতে বেশিদিন থাকবেন না, যতদিন থাকবেন এই করোনাতে আমাদের অনেকে নিয়ে গেছে। 300 doctors from Bangladesh, they are going to heaven. So you do something for the people. So with these few words, again I remembered Professor Gavriil Ilizarov for his eternal speech, and those who are connected from here and there, I salute everybody for this great occasion. And I would like to also bless my thanks to Raj TV and also the OrthoTV in India, that they are telecasted all over the country from the television. And some journalists are here also. I would like to give my thanks and bless my blessings to you also, particularly from Raj TV, Dr. Basudev is here, Dr. Aditi is here, his wife. So thank you very much for the patient benefit, for the patient hearing. And you going forward, where there is Ilizarov, where there is all the modalities of treatment is failed, then Ilizarov begins. Ilizarov started. With this home message, I would conclude my speech. Thank you very much. Thank you also. And Dobre Besa. Dobre Besa. Novikov, Dobre Besa. Professor Novikov, Dobre Besa. And Professor Harshad, Namaskar. Samsunuddha, Assalamu Alaikum. Thank you.
Welcome, sir.
Thank you very much. Thank you, our Honorable Director, sir, Professor Abdul Ghani Mullah, sir, for his excellent speech. Now, I would like to request Dr. Muhammad Murad Hussain on behalf of SKF to say something and to express the vote of thanks. And definitely, I would like to thank SKF for sponsoring our program. Before that, I would like to thank all the national faculties as well as the international faculties who are with us by sharing their knowledges and experiences with us. And especially the young Ilizarov surgeons in Bangladesh who spread the love of Ilizarov all over the Bangladesh. And a special salute to them, as because of, by the spreading of love of Ilizarov, we can give the recovery of millions of peoples. Now I'd like to request Dr. Muhammad Murad Hussain to say a vote of thanks. Before that, I am Dr. Muhammad Tanvir Ashraf, consultant orthopedics. Say bye-bye to you and assalamu alaikum to all of you.
Thank you very much, and assalamu alaikum, and a very good afternoon to all of you. First of all, I would like to express my thanks and gratitude from SKIP part to Bangladesh Orthopaedic Society, Assami Bangladesh chapter, and also to NITOR for organizing this wonderful webinar. And we are very much pleased to be a part of this seminar. And hopefully, in coming days, we'll also be a part of Bangladesh Orthopaedic Society, NITOR, and also Assami Bangladesh chapter. I just want to mention something about our brands. As you know, today our brand partner is Etoric Oxy Preparation, Etorix, the super fast painkiller, and you are all aware about the brand. Our second brand is Nabumed, that is Nabumeton, the most renal-friendly painkiller in Bangladesh. And our third brand is Naproxen and Isomeprazole combination, Naprox Plus. So I hope you all are aware of these brands, and hopefully in coming days, you all will prescribe these brands, and definitely SKF and our brands will be with you in coming days with all the clinical seminars, symposium, workshops, and trainings. Thank you. Thank you very much.
Okay, everybody, thank you for being with us. And now I would like to conclude this program, and I would like to give thanks to all the participants who joined with us. Hope we can arrange this sort of program in future. Till then, I would like to say bye-bye and assalamu alaikum to all the participants who joined with us. Bye-bye, and that's the end of this program.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.
Yeah. Dr. Tanvir, we are offline.
Can you hear me now? I have unmuted myself.
Yes, sir. I
You can hear. Huh?
Yes, sir.
Directly. Tanvir.
Tanvir bhai, you are.
Arey, Tanvir.
I think he has gone, sir. He was on stage. We can leave, sir.
No, but I am not able to hear. It's very difficult, yaar.
Yeah.
कुछ सुनाई नहीं दे रहा, बहुत कम सुनाई दे रहा है.
Then we can leave, sir. We can leave. I think they have just ending of the.
Shamshul, I am not able to hear you. Can you hear me?
Yes, sir, I can hear you. So we can leave, sir.
I can't hear you clearly. It is very far away. The voice sound. What to do?
We can leave, sir. We can leave.
Yeah. Okay. Say thanks to all on my behalf then.
Yeah.
Okay.
Novikov sir is there. Oh, so they are all leaving.
Only we four are there. Is it? All have left.
Yes, sir.
Yeah.
We can leave.
Jai Hind. Amjad bhai, kaise hain?
Novikov sir.
Dr. Harsha, yeah.
Novikov.
I have not left.
Hello.
I'm still here.
Welcome back.
Hello.
I put this white coat. Professor Shefto gave me this tie. Only because in Russia I had seen all of you put a white coat and a tie and a shirt. I thought Constantine is coming. Let me also come the same way. That's why today after a long time. How are you, sir?
Okay, Dr. Harsha. Dr. Harsha.
You can unmute yourself. Dr. Noviko. You can unmute yourself, please.
Yeah, unmute, yeah.
Unmute yourself.
Yeah, it is unmuted. Oh, shabdo hocche na or. Okay. Hello. Dr. Harsha.
Harsha sir.
Thank you very much, all of you.
Saying something.
And after pandemic, we will meet more often than now.
Okay.
Still, Shamshul, I can't hear. Shamshul, unmute.
Yes, sir.
Yeah. Okay, now 5 of us are there. Dr. Vikas, me.
Hamza sir is saying something to you, sir.
बाकी के सब चले गए.
Dr. Shamshul Huda.
अशोक श्याम का नाम रहता है, नहीं मिलते.
Ashok Sham is making live on OrthoTV, sir.
Yeah. So what news? Noviko. Summertime must be warm in Russia. Kurgan.
No,
Just now, yeah, I think more than India. Tomorrow will 37.
37.
You are in Kurgan or somewhere else?
Here, in Kurgan.
37.
Very warm.
Really?
Very warm.
Yeah.
Even when we are visiting 11, that time also it was warm. Not we thought that it would be very cold. So we took all our clothes.
I want to go to Kurgan when ice is there.
You have visited how many times, Dr. Harsha? In Kurgan? You have visited? Yeah, Dr. Amjad is speaking. Dr. Amjad is speaking. Hello.
Not able to hear. Your sounds are very, very low. I am not able to hear at all.
Oh. But I am talking in full volume.
No, your lecture I heard full voice, full sound was there. Noviko's full sound. After mine, that thing went down.
Yeah, but
volume went down a lot. I am not able to hear at all anything. Mine is 100% here.
Okay.
But it's not increasing.
Okay.
That's why. That's why I was asking Shamshul what to do. Shamshul is not helping me. All doing fine. Good.
Dr. Novikov?
Oh,
Yeah. So, what is your position now regarding this COVID in Kurgan? You have any problem in Kurgan?
each day we work, each day we have, no, in Siberia we haven't any COVID.
No COVID, no COVID.
All our life is free. This is true.
That's good, great. Yeah. Okay. So it's good that you have COVID free now. That's great. We are having COVID over here, our people. Yeah. So thank you again.
Can you speak little loudly? Can you speak little loudly?
Thank you very much. Thank you.
Thank you.
Arsad sir, can you use the microphone? Maybe you can listen.
Microphone I didn't bring, but can you speak loudly? Loudly.
Yeah. We are.
Okay, thank you.
Thank you, sir. Okay, sir. Thank you, sir. Good day, sir.
I don't
Okay,
know.
sir, leaving, sir.